Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Can oral microbiome vary with life stress in pregnant women? The number and type of microbes present in the saliva of pregnant women differ according to whether they are experiencing life stress and symptoms of anxiety, depression, and post-traumatic stress disorder, finds a study published in the open access journal BMJ Mental Health. The study included 224 pregnant women enrolled in the Michigan Prenatal Stress Study assessed for recent stresses and mental health symptoms during their second trimester. Women were asked to provide saliva samples during the week of their assessments. The results showed that oral microbiome varied with whether women had reported life stress, anxiety, depression, or post-traumatic stress disorder symptoms during the assessments. Oral microbiomes of women with high levels of post-traumatic stress disorder symptoms showed high beta diversity, which means a specific microbe species in the saliva notably differed from the species found in women with low post-traumatic stress disorder symptoms. Low-dose ketamine effectively relieves pain for ED patients, study finds. A new study that investigates low-dose ketamine as an adjunct to morphine for treating acute pain has been published in the Academic Emergency Medicine, the peer-reviewed journal of the Society for Academic Emergency Medicine. The study highlights the potential of low-dose ketamine as a valuable tool in pain management, providing a safe and effective option for emergency medicine physicians managing acute pain. Regular consumption of kimchi reduces body fat, researchers. The World Institute of Kimchi, South Korea, has been publishing a series of articles on the anti-obesity effects of kimchi in international journals. These articles, based on research studies on the subject, indicate that the regular consumption of kimchi, a traditional Korean fermented food, is effective in reducing body fat and may serve as a promising dietary strategy to combat obesity. A research study published in the Journal of Functional Foods focused on the anti-obesity effects of kimchi and its impact on gut microbes. This study investigated the changes in anthropometric measurements, blood biomarkers, and gut microbiomes of 55 overweight adults, comprising both males and females with a BMI ranging from 23 to 30 kg per meter square. The participants consumed 3 kimchi capsules per meal for 3 months. The kimchi capsules contained kimchi powder produced by freeze-dried cabbage kimchi fermented at 4 degrees centigrade for 2 weeks. The research team analyzed the changes in the body fat composition of the participants and found that the group that consumed kimchi showed a 2.6% decrease in body fat, but the control group that did not take the kimchi capsules exhibited a 4.7% increase in body fat, showing a statistically significant difference between the two groups. Eating more calories after 5 p.m. may have harmful consequences on health. According to a study published in open access format by the Nature Group journal Nutrition, diabetes consuming more than 45% of our daily calorie intake after 5 p.m. is associated with an increase in glucose levels, with the harmful consequences that this has for health regardless of the individual's weight and body fat. Maintaining high levels of glucose over long periods of time can have implications including a high risk of progression to type 2 diabetes, an increase in cardiovascular risk due to the damage that high glucose levels do to blood vessels, and increased chronic inflammation which aggravates cardiovascular and metabolic damage, said Diaz Rizzolo, postdoctoral researcher and member of the Faculty of Health Sciences at the University of Columbia. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.